members of Rotary of the West Nassau. Distinguished Mademoiselle and gentlemen, I want to thank the Rotary Club of West Nassau for inviting me to address the club today on the evolution of the situation in Haiti since the earthquake. First of all, towards you, I would like to congratulate the Rotary Foundation and its members for their long-term commitment and the important work that organization has been doing to provide humanitarian service and to help build goodwill and peace in the world. Its engagement to combat hunger, to improve health and sanitation, to provide education and job training, to promote peace and to eradicate polio is commendable. In relation to Haiti, let me take this opportunity to recognize the invaluable contribution of Rotary to the relief effort after the earthquake. Rotary clubs and districts worldwide have mobilized resources to deliver urgently needed relief to the millions affected by these devastating natural disasters. Rotarians have contributed more than $2 million to Haiti. To Haiti Earthquake Relief Fund, the donor-advised fund set up by the Rotary Foundation. I want to express my gratitude to all of you, and especially to the Rotary Club of West Nassau for your contribution to Haiti. Mr. President, distinguished member of Rotary, it has been 10 months since the earthquake struck Haiti, causing about 250,000 deaths, leaving 1.6 million people homeless, and destroying almost completely the capital for France and its surroundings. The response of the international community since the very first day and until now has been remarkable. Where are we now in Haiti? I am pleased to say that despite the difficulties, the immediate humanitarian needs of the earthquake-affected population have largely been addressed. Safe drinking water, food, household items, shelter assistance, sanitation facilities, and health services have been provided. According to a report of the United Nations, some 4.3 million people have received food aid and more than 1.5 million have received emergency shelter. Over 90% of the internally displaced persons in the capital have access to nearby health clinics, and 2.1 million people have received non-food items, including hygiene kits. A total of 11,000 latrines have been installed, sufficient for the majority of the displaced. Water supply continues to reach 1.2 million people, and the nutrition situation remains stable. Regarding the infrastructure devastated during the earthquake, the Ministry of Public Works, with the support of the international community, has accessed 289,491 buildings of an estimated total of 350,000 to 400,000 buildings, which require habilitability assessment in order to know if they are safe. Of these houses, 52% are considered structurally sound and therefore safe for habitation. 26% are assessed to need some repair work, and 21% require major repairs or are recommended for demolition. Despite this assessment, returns remain slow and reconstruction is still hampered by immense amounts of rubble and debris in the street. Efforts have been made to increase the assistance provided to communities in order to encourage resettlement to sustainable accommodation while ensuring that essential services will continue to be provided in Kent. In this regard, the humanitarian community has begun providing transitional shelter to families identified as vulnerable. Transitional shelters refer to timber or steel frame structures that last a number of years and provide better protection, more privacy, and generally more space than emergency shelters. Because they are sturdier, transitional shelters take longer to build, but unlike permanent houses, they can be moved to different locations if necessary. To date, 11,425 transitional shelters have been constructed, providing more than 50,000 patients with a safer place to live. An additional 15,454 sets of transitional shelter materials are ready to be built, and 32,235 are in the pipeline. The United Nations and its partners plan to complete the construction of 139,000 transitional shelters by mid-2011. Meanwhile, some 8,000 displaced people living in Port Kent, vulnerable to flooding or security concerns, have been relocated to safer camps outside Port-au-Prince, which provides better accommodation, extended services, sanitation, and recreation facilities. In order to provide the population affected by the earthquake with some income and at the same time to get them involved in the reconstruction activities, the program called Cash and Food Power has been developed with the help of the international community. This program has employed more than 160,000 people since January. It focuses on labor-intensive tasks such as the removal and disposal of debris and rubble, as well as the cleaning of drainage systems. In terms of education, some progress has been made. As of July 2010, 80% of primary schools had reopened, 72% in the city called Léogane, and 100% that in all the schools in Petit Bois, Grand Bois, Jacmel, 3 cities devastated by the earthquake, have been open. Last October, most of the kids went back to school. The minimum package of health services has been developed by the Ministry of Health with the support from the World Health Organization and other partners. And aid agencies in Kent are working together to ensure that key medical services are covered. The total of 302,000 children between 6 and 69 months were admitted to outpatient therapeutic feeding centers from January to June. During this period, some 633 children aged 6 to 69 months were admitted to inpatient stabilization centers, which is different. UNICEF and partners are also equipping schools with hand washing plants, latrines, water tanks, and soap. The government of Haiti increases its efforts to assume a leadership role in the coordination of humanitarian and recovery activities. As part of this, an ad hoc presidential commission on resettlement was established to coordinate all stakeholders involved in the relocation and resettlement of internally displaced people. The interim AD Recovery Commission was created by presidential decree on April 21 to coordinate and oversee recovery and reconstruction efforts under the co-chairmanship of the Prime Minister Jean-Marc Pellerin and former United States President Bill Clinton. His role is to provide high-level coordination and strategic direction by bringing together the work of key ministries and the Ministry of Planning without compromising their respective roles. This commission has held 3 meetings to analyze projects presented by the partners in the reconstruction effort. More than 100 projects estimated to cost about $2 billion have been approved. Despite all which has been done so far, the situation in general remains complex and difficult. About 1.3 million people continue to live in dire conditions in camps. While the government works without respite in order to provide the population with better living conditions, we are now facing the new challenge with the outbreak of the cholera epidemic, which has already killed more than 600 people. The government has put in place throughout the country centers for the treatment of the disease and has reinforced the capacity of the public and private hospitals in order to habilitate them to treat the infected people. It is providing safe water, medical equipment. At the same time, it launched a public information campaign on prevention measures. Pan American Health Organization is sending experts and medical supplies to treat the disease and is conducting disease surveillance. As you can see, the road ahead of us to recovery is still long and arduous, but we patients have the determination to rebuild our country and to make it better. We continue to count on the support of our friends of the global community like you from the Rotary Club of West Nassau. We look forward to continuing our collective efforts. Thank you very much. And thank you for having me.
Yes. Questions?
Federal attorneys, I'm sure you have some questions for our guest speaker. And at this time, we'll entertain questions, starting with the press.
Your Excellency Giovanni Stewart, Veterans News. There's a lot of work that has to be done to get Haiti back on top, and in fact, past the point that it was prior to the earthquake. What real role do you see the Bahamas playing in helping to get you through this reconstruction period?
The governor of Bahamas has been, since the beginning, right after the earthquake, helping Haiti. Directly and through the international community. For example, the CARICOM, Bahamas provides help to Haiti, humanitarian help right after the earthquake, and continue doing that. There is a special